This is a special announcement from JNN.
I am Alicia Lopez with Jackie Nation News, and today I am talking about the coronavirus. Our special guest is Dr. Kirk. Now, Dr. Kirk, thank you for coming and speaking with us with the coronavirus. Now, first of all, what is the coronavirus?
Well, the coronavirus is a family, actually, of viruses. In fact, if you've ever had a common cold, undoubtedly you've had a coronavirus before. So that is actually the name of a specific family of viruses. The one that's getting all of the media attention, of course, is a specific strain. As viruses do, there's going to be separate strains of viruses. And there is one that most recently was discovered in Wuhan City, China. In late December was first reported. That has become somewhat nasty. And what I mean by nasty is, instead of having the common cold symptoms like you would have with a regular coronavirus, this one is a little bit more contagious and is giving a little bit more severe symptoms than your regular common cold.
Okay, so what makes the coronavirus different from the flu virus?
Okay, so the flu virus, influenza, is a different strain or a different family of virus altogether. What is common amongst those two is that the influenza symptoms that people typically have are just about a mirror image of the symptoms that we're getting with coronavirus patients.
Okay, so how can a person minimize exposure whenever it's like
great question.
Spreading
the good thing is that we are already prepared for this kind of thing. Very simply, the same habits and the same ways that we deal with an influenza virus are the exact same when it comes to a coronavirus. So the basics of washing your hands, certainly not eating and drinking after anybody else, sneezing and coughing into your arm and these kind of things. This is all what we're already prepared for. So if you are doing your correct behaviors to prevent influenza, you're doing the same kind of thing you need for a coronavirus.
Okay. So what are the symptoms of the coronavirus, and about when should I start seeing a doctor?
Okay, just like we said, with influenza, of course you're going to have fever, body aches, chills, some cough perhaps, some of these upper respiratory type of things that you see, as well as some people reporting some nausea, vomiting, and diarrhea. These are the same things that we're seeing with the coronavirus. We're getting these same kind of symptoms. And just like the influenza virus that goes around every year, the people that are very susceptible to this and they're doing not so well with this are the same like how with flu. People that already have upper respiratory kind of things, bad lungs, frail elderly people, people that already have reasons for their immune system to be down are having a hard time with this. But the regular folks, healthy, someone young like yourself, if you ended up with a coronavirus, you'd go through the same kind of things you would as if you had flu.
Okay. All right, so is there a vaccine for the coronavirus? And if not, how soon will we be able to see one?
Well, the World Health Organization and the CDC are busy working on this kind of thing. And so with any kind of vaccine, as you know, it goes through very strenuous trials before we ever release anything into the public. So even though they are working as hard as they can and trying to come out with some sort of vaccine, we still have months and months ahead with testing and going through our trials to make sure that something's safe. No one wants to end up putting out some sort of vaccine that ends up being more dangerous than the actual thing we're trying to prevent. So we're hearing months right now, and that's kind of a nebulous answer, but they're still working on it.
And so how concerned should we be about if there's an outbreak near our area?
Luckily, certainly in a rural area, we don't have as much traffic or travel coming through this area.
Yeah.
So the likelihood of an outbreak getting here is still quite far off. Now, Georgia, the state of Georgia, is kind of unique in that I think it seems like every flight now in the nation is going through Atlanta. So, so the state of Georgia is kind of a prime target for certainly travel to come and for things to spread. But we're still in a wonderful protected kind of rural area where we're probably less likely to get hit anytime soon. Now, as far as symptoms that you should be having that you should be concerned about. If you start getting, of course, a fever and flu-like symptoms, seeing your doctor is a good idea anyways. Now, wonderfully, our school systems like ours already have protocols in place to where if you have a fever, if you have these kind of symptoms, we're going to recognize them early. Our wonderful school nurses are going to recognize that, get you out of here, and then you come to one of us and we can make that assessment.
All right. So is all of this hype about the coronavirus in the media something we should be worried about, or is it all just news media hype that we usually see?
I love this question. Okay, so, well, we live in certainly an information age.
Oh, yeah.
And social media rules just about everything that we do, say, and speak and spread around, right? So certainly there is a hype about it. I will cautiously say certainly during an election year, things love to get amplified and things become hot button topics. So we have to be very careful about where we get our information from. One thing that I've really been an advocate to tell my patients is to remember to where you get your medical information needs to be from a reputable source. A reputable source being something such as the CDC's website, which is cdc.gov, which is updated daily on all the stuff that we're learning. That is a very reputable place, of course, to learn your information. Your Facebook newsfeed and reading articles shared by people, you have to take everything kind of with a grain of salt. So there certainly is a media hype going on right now. Sessions like this and a wonderfully frequently asked questions kind of session is exactly why we do these kind of things, to kind of help calm everybody down.
Again, Dr. Kirk, thank you for being our special guest today and answering our questions about the coronavirus.
Happy to be here.
Now, again, I am Alicia Lopez for Jackie Nation News, and as always, be safe.